we have Associate Professor Fiona Kumfor, who's very kindly stepped in. She's going to tell us about some very interesting work. Her research is based around social cognition, but more recently, she's begun studying criminal behaviours in FTD, and she's also going to tell us a little bit about carer support. So I'll invite Fiona up and she'll tell us more about her work.
Thank you. Thanks very much for having me. It's so nice to be here in person. So yeah, as Morel said, I've been previously working a lot looking at social cognition, looking at how people understand emotions, empathy, social interactions. And it's led me to this sort of interesting area of research, which we've been talking about criminal risk behaviours. So that's the work that I'm going to be talking to you about this morning, or this afternoon, sorry. So let me see. Okay, so people with cognitive impairment are actually at high risk of interactions with the criminal justice system. And there's been quite a few observations in the literature or reports of these antisocial or problematic behaviours in people with frontotemporal dementia. So there's been occasional reports of antisocial or offensive behaviour. This might be things like swearing in public, out of character sexual advances, and also more common changes, things like theft and traffic violations. But this has really been mostly based on clinical observations or sort of case studies in the literature. And there's been very little prospective studies or studies where people actually go out and aim to understand what's happening in this area. Interestingly, in some cases, these changes can actually be the trigger for medical investigation. So it can even be some of the first symptoms that people have reported where someone might have out of character been particularly inappropriate or offensive, and police have been called, and that's what's ultimately led to the dementia diagnosis. So it's particularly interesting in frontotemporal dementia where these could be the sort of first symptoms. So importantly, when we talk about these behaviours, I've been using the term criminal risk behaviours rather than criminal behaviour, and that's really important from a legal perspective because we don't actually understand the intent behind these behaviours. So the legal system uses these Latin terms, actus reus and mens rea, and really it differentiates between the actual act and the intention behind the act. So if someone is committing a criminal offence, not only have they done something criminal, but there's also intention behind it where they're meaning to steal something or there's a motive or a reason behind it. But in the case of people with frontotemporal dementia, we don't know the intention behind it. So it's not a criminal behaviour per se, but it's really what we think of as an increased risk of interacting with the criminal justice system. So because this is very new research, no one had actually looked at this before. There wasn't like a test out there or a survey or a questionnaire. So the first step for us was to develop that questionnaire in the first place. So what we did was we reviewed all of the literature, and we also reviewed all of the case files of people that have been seen at Frontier over the last 10, 15 years to see what types of behaviours have been reported. And based on that, we identified a series of behaviours and then we categorised those into 10 different domains. So this is the questionnaire that we asked people to complete. And if you've been seen or your family members been seen at Frontier over the past 4 or 5 years, this may look familiar to you because we've been collecting this data for quite a few years now. But what it does is we ask people about various different types of behaviours, things like traffic violations. So this might be things like speeding, driving without a licence, going through a traffic light, stealing objects from the supermarket or from other people, not paying a service or a fee. So this might be if people go to a restaurant, then forget to pay the bill, or they go to the cinema and they don't pay for a ticket. Verbal abuse, so swearing to other people, any sort of physical assault to other people, and this can include people they know. Inappropriate behaviour, So these are things like approaching children that they don't know, or approaching strangers, kissing or hugging strangers, those sorts of things. We asked people about whether there were any public indecency, so urinating in public or perhaps taking their clothes off in public, trespassing or property damage, and illegal drug use. And then the final category was financial or professional recklessness. So this might be things like gambling, it might be things like behaving unethically at work, those sorts of things. So again, it's really important to reiterate, these aren't necessarily criminal behaviours, but what we were interested in was, were there behaviours that might lead people to be at an increased risk of interacting with police officers or security guards, hospital admissions, those sorts of things. So in addition to asking people about these behaviours, we also asked people what they were like before the diagnosis. So, you know, before their diagnosis, did they have a history of any of these antisocial behaviours? We asked people about the consequences of the behaviour. So as a result of these traffic violations or anything they reported, were police involved? Were authorities involved? Things like security guards, were, you know, they taken to the hospital, those sorts of things. And we also asked people what the patient's reaction was. So how did they respond in this situation? So as I said, we've been collecting this data for quite a few years now. So far we've had over 150 carers complete the questionnaire. And they've got a variety of different diagnoses. So most of the people have behavioural variant frontotemporal dementia. We have 30 people with semantic dementia and 13 people with what's known as right lateralized semantic dementia. So it's a rarer form of semantic dementia. We have 8 people who have progressive non-fluent aphasia and 37 people with Alzheimer's disease. And we also asked around 50 healthy older adults to complete this questionnaire. So importantly, when we asked people about their history of criminal behaviour, there was no difference between the people with dementia and control. So, you know, before there was no difference in terms of these antisocial behaviours. So in terms of, my slides have gone a bit weird. In terms of what we found so far, so you can't see it particularly well because you can see that 0, 1, 2, 3, and 4 are all white. But essentially what we have found so far is that around 40% of people with dementia reported one of these criminal risk behaviours. So it was actually quite a large proportion and much more than we had expected. So before developing this survey, I thought maybe around 5% of people might have these criminal risk behaviours, but it was much, much higher than what we expected. And we think that's partly because we asked people. So this may not be something that sort of has come up in the interview or that people have asked you about before, or maybe you haven't been systematically asked, but when we asked people, we found it was quite common. Of the 70 people who had some sort of criminal risk behaviour reported, around 20% of those that led to an interaction with either the police or a security guard or being taken to hospital or something. So again, this is much, much larger than I had anticipated. And it seems like more of an issue that's really been recognised in the literature, and quite concerning that no one's really looked at this before. So it seems to be an area of research that no one's really looked at in a lot of detail. When we looked at the different subtypes of dementia, so you can see along here down the bottom that there are some healthy older adults that still have some of these criminal risk behaviours. So, you know, there are people who are still speeding or who may swear at someone when they're being cut off in traffic, or they might not scan everything at Woolies. But when we compare that to the people with FTD, the behavioural variant of FTD and the people with this right lateralised variant of semantic dementia were much, much more common to show these sort of criminal risk behaviours. And we also looked at how severe the behaviours were, so how serious. So, you know, for example, if someone speeds 5 k's over the limit, that's not exactly the same as someone who might be physically assaulting someone. So we scored all of the behaviours depending on how severe they were. And again, we found that these two groups tended to show the more severe behaviour changes. I guess the other thing that's quite interesting is that in comparison to Alzheimer's disease, it's quite rare. So it seems to be something that's more unique to frontotemporal dementia. So when we looked at the actual types of behaviours that were reported, the most common things were verbal abuse. We also found a lot of issues in terms of financial or professional issues. Things like traffic violations. So in particular, people driving without a license, or people who might have restrictions on their license, but they weren't paying attention to them. And then around 10% of people had these sort of inappropriate behaviours, and that tended to be things like going up to strangers that they didn't know, approaching them in ways that you know, they wouldn't have done previously. But the other sorts of behaviours that you can see down the bottom here, so things like illegal drug use were very rare, not paying for a service or a fee were very rare, and actually things like public indecency were very rare. So these tended to be the sort of main issues that we had identified. So to summarise in terms of what we know so far, as I said, this seems to be a much more common issue than we had previously thought. So around 40% of people with frontotemporal dementia have at least one of these criminal risk behaviours reported. And that overall around 10% of people have reported interactions with police or security guards or authorities. In terms of the behaviours, verbal abuse seems to be the most common, but there are these sort of other antisocial behaviours that seem to be occurring, as well as things like traffic violations and financial issues. It does seem to be different depending on what a person's diagnosis is. So it seems to be particularly an issue for people with the behavioural variant. And so now what we're interested in doing is trying to understand what makes some people at risk of these behaviours. So trying to look at their cognitive profile, seeing if it's difficulties in terms of judgment or decision making. Is it because of difficulties in social cognition? So is it because they don't understand how other people are feeling anymore? Is it because they don't understand the law and they have problems in terms of understanding what's right or wrong? So why is this research important? Well, firstly, there's quite a few legal implications. So I've been working with these two researchers over at UTS, Nola Rees and Brianna Johnston. And again, some of you might have been involved in this research where we're doing some focus groups to actually talk with carers to understand exactly what happens. But these focus groups, we're also meeting with members of the police force and also other legal professionals, so solicitors and barristers, to try and understand what their experience is with people with dementia and these criminal risk behaviours. So firstly, in terms of the legal implications, we think there's a real opportunity here to educate police. So even from initial discussions with police, they seem to have a very limited understanding of what dementia is. So for example, if someone steals something from a shop and the police ask them what happened, they might say, oh, well, I took that from the shop. And the police officer will say, well, they don't have dementia because they can remember exactly what they did. So one of the things that we want to do is educate police in terms of explaining it's not just about memory, but people can have difficulties in terms of inhibition and judgment, and try and educate them in terms of how to deal with people with dementia. It's also relevant for the courts to understand these issues so that they can take it into account with things like bail applications or sentencing. As I said, there's this differentiation in the legal system between whether someone does something and their intention behind it. So again, we think it's really important to sort of have this research so that there's evidence to show that these behaviours are quite common, but that people don't necessarily have the intention behind it. And also so that it can inform things like diminished responsibility. So we're working very closely with the legal team so that we can make sure that this information is translated just not from health professionals, but also into the legal system. From a clinical point of view, we know that people with these criminal risk behaviours might be more difficult to manage, and it can also potentially be challenging for residential care facilities. So again, we think it's really important just to be able to shine a light on this issue and let people know how common it is and how difficult it is. But really what we're hoping is that by understanding the relationship between cognitive changes and these criminal risk behaviours, that we'll be able to develop prevention strategies. So are there things that we can change in someone's environment so that they don't have these criminal risk behaviours in the first place? What we've heard from carers and family members is that often what they do is just stay at home so that they don't go out into the community, and then there's less risk. But obviously that leads to more social isolation for carers and family members and patients. So we're trying to think of alternative ways where we can potentially prevent these things happening in the first place. So that really brings me to the sort of second part of this talk in terms of the carer support strategies. So we really understand the complexity of caring, but I think all of you would probably appreciate it's even more complex during a pandemic. And so we know that in particular during the COVID-19 pandemic, there's been a lack of targeted support, difficulties in terms of understanding, how to balance the risk of seeing family members and also potentially getting COVID, and also the issues in terms of having access to residential care facilities and so on. And we also know that it can be really difficult for patients because they may not understand exactly what's going on. They may be more isolated, have a loss of routine, have difficulties in terms of understanding things like mask wearing and social distancing. So we actually did a study during the COVID-19 pandemic to try and understand what the impact was for people living with dementia that might be specifically challenging during this time period. So again, you may have been involved in one of these surveys. We sent it out to everybody at Frontier and asked them about the symptoms that the patients were experiencing and also how carers were feeling. And we did this quite, I think it was the middle of 2020, so it was relatively early during the pandemic. And we also did it with our collaborators in Germany, in Spain, and in Amsterdam. So it was an international study that we did. So in terms of what we found that carers reported that patients were more depressed and more apathetic. So they had a loss of motivation. They also had some other issues in terms of anxiety and agitation and irritability. And it was much, much higher than compared to a few months before the pandemic. So there seemed to be a sort of accelerated decline over a relatively short period of time. So in that time during 2020, we heard from carers that these symptoms were really becoming worse and it was becoming difficult for them. We also asked carers about the impact it had on them or on you all. And they reported, I guess, that we can all appreciate that around half had worse mental health, so either depression or anxiety or stress. Nearly 70% of carers had a reduced social network, so they were seeing fewer people. And around 60% reported being very stressed by a reduction in visits to long-term care facilities or residential care or nursing homes. So we knew that the COVID-19 pandemic was having a big impact on patients and also on their family members. So we tried to respond to this, and what we did was developed a toolkit to try and help carers during these lockdown periods. So this is a picture of the toolkit here. Again, some of you may have already seen this, but it might be new for some of you. It's actually still available on our website now. And what it has is tips about how you can manage these different symptoms. So if you felt that your family member was having a loss of motivation or apathy, then we had some suggestions about how you could try and overcome that. And particular activities that you could do that were suitable during the lockdown period. We had this for a number of different symptoms that we knew were elevated. So depression, anxiety, irritability, and so on. And so the toolkit's very comprehensive, but this is just an example of it. And we also had some tips for carers in terms of what they could do to feel better during this time, how they could sort of become more socially connected and also try and help improve their well-being. And so what we found was that actually this was only over a 2-week period. So we asked carers about their distress, and then we gave them the toolkit for 2 weeks, and then we asked them afterwards. And we found that there was a significant reduction in their stress just from using some of the tips in this toolkit. And actually, it was particularly true for those carers who reported that the changes of their family member were moderate. So the people who were having the most difficulty seemed to benefit the most. So as I said, this toolkit's still available on our website. It is focused on during the COVID-19 lockdown, but there's still a lot of things that may be relevant for people now in terms of managing these issues. And as you can see, it seems to be really effective even over just a short time period. So you can, I think we're all very familiar with QR codes now, so you can scan that one there, or otherwise it is on the website. So the last thing I was going to mention is work that we're doing at the moment. And again, you may have heard about this study where we really want to talk to carers and understand what their needs are more, because we realise that, you know, this is a really difficult thing to be dealing with, and it has a really big impact on people's well-being. So this is a study that I'm doing with Gemma Todd and Isabella Ocampo, where we're actually having focus groups to ask people about what the impact of caring for someone with FTD is having on their own psychological well-being, what support services they've already accessed, so whether they've seen a counsellor, whether they've spoken to a Dementia Australia, any sort of other services that they've already accessed. But really, most importantly, what we're interested in is finding out what they would like. So asking if you could have whatever you wanted, you know, what would you like a support system to look like? What services would you like? So that we can use that information in terms of designing things down the track. So just to give you a little taster of what we're finding so far, a couple of really interesting things. So firstly, a lot of carers are talking about the reciprocal nature of the caring relationship. So what we're really hearing is that if the person that they're caring for is doing well, they feel better in themselves. If the person that they're caring for is struggling, that really impacts on their own well-being. So really anything that we design needs to be helping the person with dementia as well as the family member, and that these two things don't happen in isolation. The other thing that we've heard a lot about is the administrative burden. So one of the big things that people talk about that's impacting on their own well-being is dealing with things like Centrelink, with NDIS and with finances, trying to navigate the system, trying to understand exactly what's going on. And I think, again, this is something that hasn't really been recognised in the literature. A lot of emphasis is based on other aspects of the disease and less focus on the sort of administrative bureaucracy that people are dealing with. So it sounds like if we can do anything to help people deal with the bureaucracy, it's also going to help their own mental health. So in terms of where this research is going now, really it's telling us that while this is a health problem, we can't just deal with it in the health system. We need to be working with the police force, we need to be working with lawyers, we need to be working with Centrelink and the sort of other government agencies to make all of these services work together, and to really help them understand that FTD is different from Alzheimer's disease and that some of the needs that people have is quite different. And the other thing that we're trying to do is really work together with carers and families to understand what you need and what you want, so that what we're developing and what we're providing is hopefully going to be really useful. So with that, really I want to thank all of you, because without you, we wouldn't be doing any research. But these are also all of the other collaborators that have been involved. So thanks very much.